Help Me Grow is a program that focuses on early detection of at-risk children by identifying behavioral and developmental concerns at a young age and linking these children and their families to community-based programs and services. The program's founder, Dr. Paul Dworkin, knows that the best outcomes are achieved through prevention.
If we don't identify these problems early and they escalate into full-blown, difficult-to-manage diagnoses, we know then that the interventions are far less effective and far more expensive.
The Help Me Grow program began in Hartford, Connecticut in 1998 with support from the Hartford Foundation for Public Giving.
We found it really important that this project was the melding of our concerns about how the professional community works with parents on helping raise the children of Hartford.
By 2008, Help Me Grow had expanded into 7 states, and now thanks to a 3-year grant from the W.K. Kellogg Foundation, Joanna Bogan manages the team charged with overseeing replication of Help Me Grow in 10 additional states.
We know that the concept is right in Connecticut, and we also know that it's right for every state in the country.
Critically important to the replication of Help Me Grow nationally are the system's 4 core components. The first is the training of child health care providers in the process of developmental surveillance and screening.
The whole philosophy behind it is that it saves us time and allows us to do our job better and faster. The beauty of this is when I identify one of those children earlier, I can spend very little time and get them fully connected.
The second component involves networking breakfasts as a strategy to provide linkages among and across community-based programs and services.
So it's really an opportunity to connect with others. So when they do go back to their day-to-day work, they know who is their next door family resource center, or they know who is their next door early child care provider.
The third component, perhaps at the very heart of the system, is the single portal of entry to programs and services across the state.
Child Development Info Line, this is Dee.
A lot of our families are very intimidated by systems, and I feel like Help Me Grow really debunks the system mentality.
And you said you're in Bristol? Okay.
Because they're going to get on the phone and they're going to talk to somebody who has a certain level of sensitivity and understanding about what their needs might be, and they're going to take the time to listen.
And the fourth component is the compilation of data regarding the effectiveness of those linkages.
Our feeling is that 17 states will enable us to reach the so-called tipping point, and our hope is that we will work with federal agencies and the Congress to bring about legislation that will enable ongoing support to the National Center and enable any state interested in replicating Help Me Grow to receive the assistance that they need to do so. Our ultimate goal is to have Help Me Grow in every state.